Hello, my name is George Robinson from University College London, and it's my privilege to speak to you today about our new paper in eBiomedicine, which identifies a new biomarker of cardiovascular risk in juvenile lupus patients. Lupus is an autoimmune disease characterized by chronic inflammation and increased cardiovascular disease risk. The increased cardiovascular disease risk is a leading cause of mortality for patients, and it's likely due to altered lipid metabolism and increased inflammation. But despite this, there are currently no guidelines for cardiovascular disease management in lupus. There's a need for new early biomarkers of cardiovascular disease risk in juvenile lupus patients. This will help with early therapeutic intervention to reduce mortality. In our study, we used in-depth NMR metabolomics of atherogenic and atheroprotective lipoproteins to cluster a discovery cohort of juvenile lupus patients by atherosclerotic and cardiometabolic risk. We identified 3 groups, 2 of which were validated in a validation cohort of 31 patients. Group 1 had an atherogenic lipoprotein profile compared to Group 2, which was validated by metabolites associated with subclinical atherosclerotic plaque in adult lupus patients, suggesting an increased cardiometabolic risk. We next used adjusted logistic regression and ROC analysis of over 200 metabolites and identified the Apo-B to Apo-A1 ratio as a powerful biomarker to differentiate between the validated groups, which specifically was increased in the high cardiometabolic risk Group 1. Flow cytometry and RNA sequencing analysis identified increased CD8 T cells with altered interferon signaling pathways in the high Apo-B to A1 ratio group. These pathways overlapped with those dysregulated in human and mouse atherosclerotic plaque. Finally, longitudinal analysis of clinical patient outcomes identified a persistently increased disease activity in the high Apo-B to A1 ratio group. So these high-risk patients could be identified clinically from a young age for increased disease monitoring and interventions to improve quality of life.